Any types of surgery have potential for complications. Spine surgery is no different. Before you go for spine surgery, you need to understand about the risk of the procedure. In this video, I'm going to explain the possible risks associated with spine surgery. If you are new to my channel, my name is Dr. Tony Setiobudi. I'm an orthopedic and a spine surgeon at Mount Elizabeth Hospital, Singapore. Please help me to subscribe and activate the notification button. I will continue sharing more medical information that is useful, up-to-date, and trustworthy that can be understood by all of you. The risks of anesthesia are generally related to the overall health of the patients. The anesthetist is the one explaining to the patient before the surgery. When we talk about spine surgery, the biggest fear of the patient is about paralysis. This is a devastating complication of spine surgery. Fortunately, it is rare, very rare, less than 1%. Other risks and potential complications of spine surgery include bleeding, infection, blood clot, dural tear, nerve injury, and persistent pain. Fortunately, the likelihood that any of these will occur during or after the surgery is rare. The procedure from the incision to the closure of surgical wound are meticulously performed to minimize and reduce blood loss. However, injury to major blood vessels can happen, which can cause bleeding. Bigger operation has more bleeding. Sometimes blood transfusion is needed during and after the surgery to replace the blood loss. Patients undergoing spine surgery are at risk of developing blood clot inside the vein in their legs, a condition commonly known as deep vein thrombosis or DVT. Calf pumps to massage the muscles in the legs during the operation are useful to reduce the risk of blood clot. Post-operatively, blood thinning is also given when appropriate. Blood clot in the leg can travel to the lungs, causing pulmonary embolism or blockage of the pulmonary major blood vessel. This condition is life-threatening. Blood clot in the leg can also slow down the rehabilitation. Dura is the covering layer of the nerve. It is like the cloth to the nerve. A dural tear occurs when the dura covering the spinal cord or the spinal nerve is torn during the procedure. I always repair intraoperative dural tear immediately during the surgery itself. Most dural tears heal without any incident. However, if it does not heal, the spinal fluid can leak out through the tear and the wound and cause a spinal headache and wound infection. If this happens, operative repair of the dural tear is needed to be done again. The risk of infection following spinal surgery is small in most patients. Antibiotics are given immediately before the surgery and continue for a few days after the surgery to reduce the risk of infection. If an infection does develop, it may be superficial, means in the skin only, or it can spread deeper to the areas around the spinal cord, the nerves, and the bone. Deep wound infection requires reoperation to clean the infection. Common signs and symptoms of infection include: number 1, a red hot and swollen wound. Number 2, worsening pain. 3, fever. Number 4, clear liquid or yellow pus oozing from the wound. Number 5, a foul-smelling odor at the wound site. Although it is rare, spinal nerve can be injured during spine surgery. Great care is taken during the surgery to reduce the risk of nerve injury. Nerve transection or a cut in the nerve is extremely rare. It can cause permanent damage to the nerve and this is irreparable. Fortunately, it is very rare. More commonly, nerve injury happens after the nerve retraction. Usually, it is not permanent and recovers with time. Nerve injury can cause weakness, numbness in the legs or arms, or even paralysis. After spine surgery, your recovery journey begins. The recovery can be fast or long and challenging depending on the types of surgery performed. It may be many weeks or months before you become more comfortable than before the surgery. And in some cases, spine surgery does not completely reduce or resolve the pain. Rarely, it may actually increase your pain and make it worse than before the surgery. In summary, the risk of spine surgery are not common, but it is important for you to understand any potential complications that can occur during and after the surgery. You can ask your surgeon if you have any questions regarding the surgery. And I hope this information is useful to all of you, especially if you are considering spine surgery. Feel free to type some comments and questions. Don't forget to subscribe, like, comment, and share this video. And I hope to see you again in my next video. Bye-bye.